Thank you for joining us inside of Rejuva Medical Spa and Clinic. And sitting beside me is Dr. Bart Rademaker, whom many of you have asked me about, and we thought we would have him tell you his personal story using manual lymph drainage in his practice and also as a patient himself. But before we do that, Dr. Rademaker, you kind of broke the mold in surgery. You know that.
Yeah, I guess I did, yes.
You are unlike most surgeons that we see, and the thoughts that people have about surgery are changing by the day. Can you tell us a little bit about yourself and your practice?
Well, truly, I think I have a much more global perspective of all that we do. And so my approach to all my patients, they're more clients actually, is not just from a surgical perspective, but it's really about the complete transformation that they can embrace and to create the changes that they want to create. And I guess a lot of that stems from my vast experience. I've lived in many different countries, fluent in 4 different languages,
Yes.
and just allowed me to have this open space where I can bring in all these amazing modalities like manual lymphatic drainage, and then offer them to all my clients.
As I've even seen quite a difference in your surgical skills than what I typically see here in the United States. And seeing how you actually operate with that complete knowledge of the lymphatic system. Would you say that that's true, or would you have some commentary? Because I know people would like to know.
No, I think that's very true. I've always ascribed to the attitude that every little detail counts in all the things that we do. And, my concern sometimes is that so many are not in that mindset, and they simply perform the surgery without enough respect to all the other elements that make a big difference. And the truth is that every single element on its own won't make a big difference, but when you add all of that up, and that's exactly what we do. And we're finding that trend happening more and more. I'm glad to say that, because we're realizing the value of so many other modalities that are out there that can create the changes, create the transformations that we're looking to achieve. So it's not, straightforward, simple, okay, let's do surgery and that's it. What else is out there that can either replace that or completely complement and get a much better outcome? And that's our focus. It's just not performing surgery, but what is it that we can do to get the absolute best outcome in all areas?
Just with seeing the difference of surgery without lymphatic drainage, pre and post-op, versus those who do use lymphatic drainage, in your own observation and skills, what have you seen is the benefit?
No, there's an absolute benefit, and it actually makes sense. I mean, if you just stop to think about it, and that's what we like to do here as well. Quite simply this, is that the lymphatic system is a much undervalued, under-recognized part of our whole organ systems. And the function of the lymphatic system is critical in our overall health. Because just as well as I do, is that there are many toxins that are created for a variety of different reasons, and the lymphatic system basically picks those toxins and allows the body to either cushion them, protect them, or get rid of them. And surgery is no exception to that, because it's an insult to the body. Lots of toxins are created, and the body has to have a way to rid itself of those toxins. Now, the lymphatic system, when it gets overwhelmed, when it gets overloaded, can't manage that volume of toxins, and that's where the manual lymphatic drainage is critical, because that simply enhances the body's ability to optimize the lymphatic system, clear out the toxins, and therefore place the body in a much better healthy situation, if you will, and healing situation, so that patients can recover much more quickly. And so the beauty of manual lymphatic drainage is simply completely under-recognized, and is critical in getting better results in all of our surgical patients. And in fact, even when it's not surgical, there's a lot of tremendous benefits to get rid of those toxins from our body through manual lymphatic drainage.
So basically, if I can summarize it in a nutshell, is a person could expect that there would be a minimum or a minimization of some of the post-surgical effects, such as the swelling, some of the bruising, the discomfort, that it may still be there, but not to the extent it would be if you didn't have your lymphatic drainage. And as a result, that it wouldn't be there for as long as it typically would be.
Right. You know, that's honestly the hardest part of demonstrating to our clients, you know, what the real benefit of manual lymphatic drainage, because it is completely different than your usual massage, and that's what we are accustomed to. And so somebody undergoing the manual lymphatic drainage, they never really understand or really know how wonderful it actually is unless they have the opportunity to compare a prior surgery. And so the distinction is that if somebody's had surgery before and they have surgery now, and then the first time without and now with, that's the time when people really truly understand, look, this is so much better. The bottom line is this, is that manual lymphatic drainage is critical in the recovery after surgery for any kind of surgery. And the testimony, if you will, from patients then is that they find that they do recover more quickly than, say, somebody else who's not had, you know, those treatments.
You were just listening to Dr. Rademaker of the Rejuva Center for Plastic Surgery and Elisa DiFalco of the MLD Institute International.